you've been treating this infection in your private area, and after a few days or a few weeks, it comes back again, and you're wondering what is happening. The things I'm talking about in this video might be the reason why. So let's go straight into it. Hi, welcome back to my channel. In case you're new here, my name is Ada. I'm a medical doctor living and practicing in Nigeria. I make content on health, motherhood, and lifestyle. So let's just go straight to the reason. Number one, you're not using the right medication. So sometimes the infection you're treating might be stronger than the antibiotic or the drug that you're using to treat it. This is what we call resistance. Now, when you have a resistant organism, no matter how hard you use a particular drug to treat it, it's not going to work. So what should be done? A sample should be collected from your private area and then sent to the lab. In the lab, that organism is going to be grown. That is what we call culture. And then certain antibiotics will be tried in the lab against it, and then the one that works is the one that it is sensitive to. So normally your doctor would say do a microscopic culture and sensitivity, and then we tell you, okay, use this drug. This might be the reason why the infection has not gone. Number two, you don't finish your medication. So you've done the MCS, that's the microscopic culture and sensitivity. They've given you medicine and they say take it for 10 days. After 3 days, you're feeling good, you're feeling happy, you forget about the medication. You did not end up taking it for that 10 days. What you might have done is to make the bacteria to sleep small, and then after a few weeks it will be back again, because you did not beat the organism to die. You just beat it small and allowed it to recover. And the problem is that when it recovers, it might still become resistant to the drug that you have just used. So when you're giving medication, try your best. I know sometimes you forget and all of that. I myself am bad at taking medication, but you just have to try and finish it. If they say 10 days, take it for 10 days. If they say 1 week, take it for 1 week, so that you don't have issues afterwards. Number three, your partner is not treated. Now, if what is giving you this infection is an STI, which is a sexually transmitted infection, you need to be treated with your partner. If not, you will treat the thing, it will go, then you have intercourse with your partner gives you again, and you treat and it goes, and the cycle continues. So typically, if you're treating a sexually transmitted infection, you have to treat with your partner. If not, work done is equal to zero. Number four, you have bad habits that are predisposing you to infection, which might be the reason that you're having this recurrence of infection. What are these bad habits that you could have? You're using soaps, you're using wash, you're using all sorts of things to wash down there. Do you know what you're doing? The private area has a balance that must be maintained. It has a chemical balance and a microbiological balance. So the chemical balance, it has an acidic pH, so it's more acidic, which makes that bacteria does not typically thrive there. For the microbiological balance, it has good bacteria, yes, actual bacteria that lives down there, and that's normal. That good bacteria is there to occupy space and make sure that bad bacteria does not go. So if you do anything that kills off this good bacteria or reduces the pH of the area, you're going to have infections. You stop using soap there. Another bad habit is that any small thing you're taking antibiotics, small headache, antibiotics, hey, you're just altering balances everywhere in your body, not just the private area. And this could predispose you to having recurrent infections. And guess what? The type of infections you have will be typically resistant ones, because you've used all sorts of antibiotics. And so the bacteria that is now thriving in your body is the one that is resistant to all those things. So stop taking antibiotics anyhow. And stop spraying perfume. Yes, some people spray perfume down there. Why? Why are you spraying perfume? Why are you spraying perfume down there? Don't spray perfume in that place. Thank you. Number five is general hygiene. Wear clean, dry pants. It's rainy season now and our pants are not really drying. Don't wear them like that. If you wear them like that, things like candida, which is yeast, thrive in very moist areas. And you know that that area is already moist, depending on the time of the month, right? So when you're now wearing wet pants, it will now worsen the matter and allow fungi to grow in that place. So don't do that. Wear clean and allow that underwear to dry before you wear it. Thank you. And then as a woman, I don't know, normally our mothers teach us this, but I'm usually surprised when some women don't know. So let's say it here. You're supposed to wipe from front to back. When you're cleaning your inner region, say you finish pooing, you're supposed to wipe from front to back. Reason being that if you wipe from back to front, you're introducing bacteria from the bum bum into your private area, and that's not very good, and that could predispose you to having infections, especially urinary tract infections. Actually, the final thing that could be the reason why this infection is not going is that you might not actually have an infection. Yes, could be that you're reacting to something and so many other reasons. Now, I have a video where I explained what people call toilet infection, and I went into details about vaginal infections and whether it's an infection or is not an infection. I'll leave that in the comment section and in the description box so that you can go check it out if you want. If you enjoyed this or you learned a thing or two, please hit the like button and leave a comment so that this video will reach other women and other people, so that more people can see this video and learn from it. And of course, let our family grow. Yes, I'm not being shameful about it. Our family needs to grow because we're doing beautiful things here. Thank you so much for watching, and as always, stay healthy, and I'll see you in the next video. Bye.